Hello, my name is Dr. Bob DeMaria, the Drugless Doctor, and today we're going to get to know about men's health. We're going to talk about 4 different age categories and what I have learned over my career, how it impacts different men at their different times of their life. We're going to start with 20 to 35-year-old individuals. It's very fascinating because all through most men's life that I see in my practice, they never think about growing old. And I'm not saying I have to be silly. One of the toughest patients that I have to see in my practice are men between 25 and 45 years old, because they still think that they're 19 years old, but little do they know that their testosterone is quickly going down in our environment as we know it today. But between 20 and 35 years old, what starts to occur, especially right around that 25-year-old mark, is lack of blood flow or reduced blood flow to the discs in the spine, especially in the low back region. Oftentimes I'll start to see young men come into our practice right before they're 30 years old complaining of low back pain. You know, they become weekend warriors. That is, every weekend they're out playing softball, baseball, throwing horseshoes, horseback riding, golfing, shooting, fishing, whatever they can, bungee cord jumping, and they have pain. And they never had pain before. Pain brings men to the practice. They want that pain relieved. They want it relieved now. If you have sharp pain in the lower part of your spine, when you're in those age categories, you probably have done a little bit too much. And let me make this note to you. Any day is a good day to stop smoking, regardless of any age. People who smoke cigarettes, especially, of course, you men, have a greater chance to have chronic spinal pain and spinal dysfunction because cigarette smoking decreases blood flow. What I've seen with individuals with hair loss is trans fat is the issue. So stop eating all those pastries and French fries and chicken nuggets and start focusing on avocados, flax oil, a great marine oil like anchovy and sardine oil that does not have a lot of toxins in it. We have seen a beginning of an epidemic of young men coming to my office, not quite 35 years old yet, thinking about starting a family, then thinking about having life insurance, and they go in to be tested and their blood sugar is up or their cholesterol is up, and they start having an add-on to their life insurance policy. Can I make this suggestion to you? Regardless of your age, but especially between the 20 and 35-year-old age group, there's a blood test called an HA1C. You maybe have never heard that before. HA1C. That is a blood glucose test that has attached to your red blood cell. You want that to be within normal. That's a pre-diabetic blood test. You want that checked. You want that under control. Because the trend's going to be in the future, you're going to be paying high insurance premiums if you have a poor quality HA1C and your BMI testing, your base metabolic index or your body mass index is too high. So let's move on to the 36 to 50-year-olds. What I'm starting to see now is you're more than likely married with a child or two. A lot of stress, right? You betcha. Right about when you hit 40 years old, I'll have gentlemen come into my office, and they always do it the same way. They look at me and they say, Dr. Bob, they gave me a drug, an antidepressant, just to take the edge off. Very common for men right around 40 years old to be suggested that they are on an antidepressant. Not a good thing. You want to make sure, as I mentioned to you, minimize that trans fat. Get some avocados in your body, flax oil, olive oil, and a great marine oil. You should have been exercising all along. For sure right now, when you're in that 36 to 50-year-old group, you better be exercising every day. And exercising is not golfing, by the way. or bowling. Exercise is getting out and getting that heart rate up. You should be doing some fitness training with weights, with bands, with machines. You want to be active every day. Maybe take one day off a week where you just totally rest, but you can exercise different parts of your body. Between that 35 and 50-year-old group, 36 to 50, you want to make sure that you're very active. Now, something very frightening happens when you're 45 years old. You know what that is? You finally realize you're getting old. You look in the mirror, and because you've been stressed your whole life up to this point, you failed to realize that all that stress was causing cortisone to be released, and it's actually cannibalizing your muscles. Whoa, what does that mean, Dr. Bob? That means that your body has been burning muscle for fuel. And between 40 and 50 years old, every decade, you lose between 5 to 10% of your muscle bulk. That's going to give you a harder time to lose weight and for you to keep your blood sugar or your glucose under control. And right around that same time period, so these 40s are tough on men between 36 and 50, but those 40s, your testosterone level starts to go low. That's going to be a sad day for you right now, I can tell you that, because your libido goes away. You need to rest. You need to avoid sugar. So now you're 51 years old. Let's talk about you 51 to 65-year-olds. That's the time when everything starts to really change. This is where you need to have more discipline. Let me give you a key statement. Discipline is freedom. Discipline from that bowl of ice cream before you go to bed at night. Discipline from that extra pastry that you want to have at your business meeting. Discipline from going to the fast food restaurant and getting that large order of fries, that extra large burger. Because unless you burn those calories off, you're going to find out that you're going to start having issues with clinical and morbid obesity, and your blood sugar starts to go up, gentlemen, at 51 to 65 years old. Have you had your HA1C done? What about your cholesterol? You see what happens between 51 and 65 years old, and your cholesterol is going up, and they put you on a medication to lower your cholesterol. It has bad effects. One of those bad effects are lack of libido, lack of interest to engage in intimate activity. Already in your 40s, you're starting to lose testosterone and muscle bulk. But when you're 55, 60 years old, are you waking up 4 or 5 times during the night to urinate? Your prostate is enlarging. You have some major challenges right now, don't you? You're craving sugar in the middle of the nighttime. You've been eating too many pizzas, too many pastries. Wheat depletes the body of zinc. When you don't have enough zinc, guess what happens to your memory? It goes away. You start noticing large pores on your face, white spots in your nails, pain in your heels because your prostate is swollen. They're thinking about roto-rooting your prostate gland. Let me scare you a little bit. They will literally grab a hold of your penis and roto-root your prostate if it gets too enlarged. So would you want to continue to eat wheat and pizza and cookies and possibly have a low zinc level, losing your memory? This is very serious. I have men that come into my office every week with tears in their eyes because they want to do surgery to them. Can I throw out one other little nugget to you in this time period? Stop drinking the diet soda. Anytime I have a man that comes into our office and they're drinking diet soda, greater potential to have tumors, skin rashes, headaches. You're fastly approaching 65 years old. Let me talk to you all 65 years and over. Your posture is so important. You should have been regularly exercising. If you're not right now, buy one of those large exercise balls, 55 centimeters. Start laying back in that ball every day. You're really concerned about your blood sugar right now. Now's the time that you better be exercising every day. You want that heart rate up. You want to be exercising regularly. You want to be drinking more water. But do you know what really happens after you're 65 years old? You start thinking about what you don't remember. You know, there are different herbs and nutrients that you can use, but can I share this with you? I already told you to do this when you're in your 20s and 30s. Avocados. Avocados are your secret weapon. They have something in them called carnitine. Carnitine is for cognitive behavior. Because the last thing you want to do when you're 7 years old is kind of scratch your head in the mirror and wonder if you had lunch yet or not. When is the last time that you went to the bathroom? But what really is serious, as I start to notice men over 65 years old stop eating protein. You need protein. Whether it be in the form of chicken soup or turkey soup, you want protein in your body. Protein helps muscle development. Protein is going to stop your structure from breaking down. You really want to make sure that you're consuming nuts. Almonds, walnuts are the best. Walnuts are for your brain. Almonds are a great source of calcium. You want to be exercising regularly every day. Be in the sunshine. The sunshine causes the cholesterol in your skin to turn to vitamin D. Vitamin D helps calcium absorption in your body. So let me wrap it all together. Let's go back. You're in your 20s. Make sure you're drinking water. Let's just start doing it right now. Stop cigarette smoking. Make the wise choice to minimize or eliminate fast food, franchise food from your life. Go to culinary school. Go to a class. Learn how to cook food at home. It'll save you money in the long run. You want to be exercising on a regular basis. Spend time with your family. Spend time with your loved ones. That's so significant. Avoid canned food. Avoid processed food. Minimize your wheat. Say no to soy. It'll help your sex life, I guarantee that. You want to make sure you're drinking water from a pure source. Eat as much organic that you possibly can. Eat quality-based foods. Get plenty of sleep. But probably the most important thing that you can do is make sure that you're consuming the right oil from a quality source. I'm Dr. Bob DeMaria, the Drugless Doctor. Thank you for joining me today.